Hello everyone. Now we're going to discuss with you how to control the bleeding from the wounds of extremities. This may be cut wounds or lacerated wounds, and different types of bleeding can occur from these wounds. It can be classified according to the vessel that was damaged. So if it was artery, we have arterial bleeding. If it is vein, venous bleeding. If small capillaries were damaged, it is a capillary bleeding. So the capillary bleeding is less intensive and less dangerous. And arterial bleeding can lead to death of the patient within a very short period of time. So what are the ways to stop the bleeding? First of all, if it is a capillary bleeding or venous bleeding, you can apply direct pressure on the wound. You can pack it with some cloths, some bandages. You can use chemical substances like Xelax to pack inside the wound. What you should not do, you should not take the bandage away and look how is it doing inside. If you pack it, you should take this patient to the hospital. There is another way to stop the bleeding, especially if it is arterial bleeding. You can press the artery more proximally from the wound. So if we have a wound on the upper extremity, the best place to press the artery is axillary region. This is a medial surface of the humerus, and you can press artery directly to the humeral bone there. This is the quickest way to stop the bleeding. After that, you can apply a tourniquet on this area. For wounds of the forearm, you can stop the bleeding if you will flex elbow joint. And maximum flexion of this elbow joint can compress the artery. If we are talking about lower extremities, there is an area of upper thigh where you can compress the artery to the pubic bone. And another place is popliteal area. We can compress popliteal artery by means of extremal flexion of the knee joint. About tourniquet application, you should remember some very simple, necessary rules. So first of all, you should not apply a tourniquet on the bare skin. It's better to apply some soft padding under it. When the tourniquet was applied, you should write down the time when it was done. And remember that you should not keep the tourniquet more than 2 hours in summertime and more than 1 hour in wintertime. If you should travel for a long way and your travel time is more than 2 hours, periodically you should remove the tourniquet but compress the artery proximally to prevent bleeding. Also, you should remember about the places where a tourniquet should be applied. You shouldn't apply tourniquet at the areas of joints, as you can't compress arteries there. For upper extremity, the best place of tourniquet application is upper third. You should avoid placing the tourniquet in the junction of the middle and distal third, as radial nerve can be compressed there. For lower extremity, you can apply a tourniquet on the thigh. It may be lower set, upper set. Actually, these things doesn't matter. And you should also remember then when you apply a tourniquet, you should tighten it correctly. Because if the tourniquet is not tightened well, you can compress veins but not arteries. And in this case, the bleeding may be more intensive. So to control the pressure of tourniquet application, you should check the pulse rate. If the pulse is disappearing and bleeding stops, you understand that the tourniquet was applied properly. Also, for capillary bleeding, when you apply a pressure bandage, you may apply ice pack on this area, and the bleeding will be less. Thank you very much for your attention.